Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about wound healing. So wound healing, I'm using a diagram from Shield Healthcare on their website because it actually does a pretty good job of showing it to you so I can actually walk you through the process here. But let's take a step back before we go into the diagrams and say there's a couple different key pieces of wound healing. And one is you want to have sufficient blood flow coming in. If you don't have the sufficient blood flow coming in, you're gonna have a hard time healing. So you got to make sure you got the sufficient blood flow. Number two, you want to maintain a moist environment, not a wet environment, but a moist environment, because the cell motion is allowed through that moist environment. It also allows the removal of bad tissues through that moisture as well. So it allows things to come in and take the dead tissues, the injured tissues out of the area. So let's walk you through this process. It's basically a 4-stage process. The first stage is hemostasis. Hemostasis is basically blood clotting. You got bleeding, you got, as it's showing right here, you got blood bleeding from the blood vessel from the injury of the tissue. And so what you're going to do is you're going to create a blood clot. The platelet cells and everything will come in and they'll clot that tissue, and they stop the bleeding, they stop the continued damage. So that clot is important. Once you have the clot, then you create an inflammatory stage, or the inflammation in that area. The idea with the inflammation is it allows fibroblasts and macrophages to migrate to the area. And the fibroblasts and macrophages will actually take that scab, that clot, and it will actually start to break down the dead tissue, break down the clotting, break down the injury, and start the process of cleaning up all the dead tissues and so forth. And then you get to the next stage, the third stage, which is proliferative stage. Proliferative means that it's growing in. So the process is the fibroblasts are proliferating into the area. So the macrophages do some of the cleanup. The fibroblasts go in and start to lay down new tissue, starts to do that, and you're getting repair of the subcutaneous fat, repair of the blood vessel. You get proliferation of new blood vessels coming to the area to help in that process of healing. Then you get to that final stage where the tissue gets freshly healed and it starts to remodel. So you've got it closed, then it starts to remodel so it gets back to the normal appearance and normal presentation. So again, 4 stages. Hemostasis, where you get the clotting, you stop the injury. Inflammatory, where it starts to clean up the process. Proliferative, where it works on healing it. And then remodeling. So once it is healed, then it gets back to normal presentation by remodeling it back to the normal tissue. This is Dr. Brandt Gibson, and that's the process you want to go through here with healing. If you'd like additional information, you can reach out to us at utahfootdoc.com. We would love to help you. If you got a wound, there's things we can do to speed up that process to help you improve your circulation. There's things that we can do to help you maintain the moist environment. And there's things that we can help you to do to go through these 4 stages so that you can go from the hemostasis stage where you're at, or the inflammatory stage where you're at, and take you through the remodeling and the proliferative stage, the proliferative and remodeling stage, so that truthfully you can actually get back to normal tissue and get back to normal activities that you want to do. So this is Dr. Brandt Gibson. Have a great rest of your day. This is Podiatry Tips Day 387. Thank you.